coming back to the numbers from our trusted friends over at LSI. So they had this one headline about the U.S. market strength. And so there's about 95.7 million procedures that have been done, and it's getting close to the 100 million procedure mark, right? But when you look at that in context to other things, like let's say, HIV or malaria or all these different things, right? It's still not as big. But I'm wondering, you feel like one of the big problems is that this sort of lack of access to surgery is a bigger crisis. I think, correct me if I'm wrong, you were quoted on saying that as well, right? That there's that lack of, here we go, yeah, that lack of access to surgery. It's a bigger crisis than HIV, TB, and malaria combined, right? But again, the problem is that it rarely leads in global conversations. Why do you think that is? What's the plan to sort of get attention? I think a lot of these issues get solved through better marketing of getting people's attention first, and then everything else flows from it.
Well, I think it gets to that wicked problem again. So HIV, TB, and malaria are wicked problems, and people are focusing on them using technologies like vaccines and antibiotics or other medications. And those have the kind of characteristic that if you can take a high-tech solution like a vaccine or a medication and you can create it, it becomes very easier to distribute it all over the place. And, if you can get other kinds of vaccines or medications there, you can get these new ones there. Problems like surgical care are multifactorial. It's not that you can create surgical care somewhere and ship it and deliver it to a patient. You need to build the infrastructure in place. You need to build the educational infrastructure. You need to, it's educational, it's healthcare economics, it's the physical plant, it's the transportation system, it is the pre-hospital trauma that gets people there in time so that you can actually operate on them. There are so many factors, and trying to solve them all at once in all of these different places in the world feels like an intractable problem. And so, although more people, so about 17 million people a year, die from postpartum hemorrhage, traffic accidents, surgically treatable and curable conditions. And the reason why is surgery was not available to them where they had that crisis that needed surgical intervention. And when we think about how to compare that to deaths from cancer globally are about 10 million. So 17 million from no surgery, 10 million from cancer, 3 to 3.5 million from HIV, TB, and malaria combined. And so when I say these problems are of different magnitudes, it's never to say that we should not be focusing on HIV, TB, and malaria, or that we should not be focusing on cancer. It's that we should be trying to figure out how we scale access to surgery. And when we step back, we really need to solve that wicked problem of training. Comes back to what we were first talking about, which is see one, do one, teach one, cannot get us to the point where we have enough clinicians trained at a very, very high quality that will ever meet the needs of those patients in the future who, unless we do something different, will continue to not have surgical options when they are in those accidents or when they are bleeding to death.